Hi, I'm Sarah from Woodborough House. This is a message for the chaperones who kindly escort our patients to and from their dental appointment. Many people are anxious about dental treatment, so at Woodborough House we have many ways of dealing with that. One of the things we do is give our patients oral sedation or intravenous sedation. When we use oral or intravenous sedation, we use a drug called a benzodiazepine. We have several different types that we can use. Basically, it makes somebody very relaxed, so they're no longer anxious, but it can also make them very, very sleepy. It's a bit like they've had too many drinks. At the end of the day, it is a drug. So that's why we need a chaperone to come with them to make sure that when they're going home, they're going to be safe. As a chaperone, it's really important you come in before we administer the drug so that we can chat to you as well as your friend or family member about what we're going to do and how to look after them afterwards. The patient having the procedure is often very nervous and may not listen to anything we say, which is completely normal. So we ask that you come and attend the appointment first, and we go through what to expect and what to do afterwards. The drugs we use for sedation are very safe. It doesn't put the patient completely to sleep, it just relaxes them. When we do a procedure, we like to take your number so we can call you when your friend or family member is ready to be collected. We do try and give guide times, but we don't always run exactly to time as dentists, and sometimes procedures take a little bit longer because sometimes it's more complex than we thought. We never want you to worry, so what we'll do is get one of our reception team to call you when your friend or family member is ready for collection. Now, it's really important when you pick them up that you realise what they're going to be like. A lot of our chaperones are a little bit surprised because they may have never seen somebody having had sedation before, which is perfectly normal. So they will vary in how they respond to the sedation. They're often very happy, they're often very lively. Sometimes they can be a bit sleepy and groggy. Sometimes they have difficulty walking. So it's really important as a chaperone that you realise that they're not safe just to walk on their own. They're going to need you to hang on to their arm, sometimes two people to hang on to them. We can help you with your friend or family member into the car. When you get them in the car, they most likely will fall asleep. This alarms some chaperones, but it's completely normal because they're finally out of the procedure, they're probably relaxing anyway, and the drug is still in their system for up to 24 hours. When you get to your destination, usually you can wake them up pretty easily and take them inside. If they're a bigger person, it may be sensible to have someone to help you at the other end, because if you're small yourself, you may struggle to physically get them out of the car and inside. Even though they're awake and conscious, they can be quite heavy because they're a little bit sedated still. When you get them inside, there's lots and lots of instructions that we give you. We give you a written copy. When you get the patient home, make sure they're either in bed or a comfy chair, and you stay with them all day, and preferably the evening as well. There's a few things to note when you get home. In the pre-surgical, pre-sedation appointment, when you come with the patient, you'll have got the instructions, they're all written down, and you'll be able to follow them absolutely when you get home. If we do give any antibiotics or any painkillers, we'll write that so you know when to give the next one. Painkillers, there are lots of different types, and it depends on if you've got any allergies, so that will be written specifically bespoke for the patient. Now, the patient will be numb because even though they're sedated, they will have been given injections, so their lips and tongue and cheek will be numb. It's really important you don't give them anything too hot and anything that's too chewy. They really should be having a very soft diet so they're not likely to bite into their lips or tongue, and just keep an eye on them when they're doing that. Make sure you administer the drugs that are prescribed as prescribed on a regular basis, even if they say they don't want to have them. When someone's sedated, they can sometimes be a little bit chatty and they might try and argue a bit with you, but they need to follow the prescription of the dentist. They will also, if they've had a tooth out or had surgery, have some oozing of bleeding. Now, this is completely normal. Don't be alarmed if you think, gosh, that seems like there's a lot of blood. Just the same as when you put a drop of food colouring into some water, the same happens in your mouth. So if you've got a little bit of oozing of blood, it mixes with your saliva and it can appear to be a larger quantity than what it is. If you're very concerned about the bleeding, then please do give us a ring. But to reassure you, unless it's running like you've turned a tap on, you really don't have to worry about bleeding. What you don't want is to keep looking and keep taking the tissue or the piece of gauze out and keep peeping in and out, because that will irritate the site and it will keep oozing. The other thing to do is to make sure that the patient avoids alcohol, which hopefully you would think to do anyway, smoking and any form of exercise. It's really important to avoid all of those things and to make sure you have a soft diet.